how much testosterone do you need to maintain your physique once developed? And let's talk about muscular physiques that have been built, like bodybuilders, maybe using cycles of higher testosterone or other anabolic steroids. So once you say, okay, I'm not going to use any cycles anymore, let's just do TRT, how much testosterone would one need depending on their muscularity?
This is the TRT and Hormone Optimization YouTube channel. And if you want to learn all about the science-based information on this topic, consider subscribing, hit that notification bell, and you'll be on your way.
Well, that's a good point. I think you answered the question. I mean, there's a lot. It depends. Depends. All right. All my travels through, 4 decades of doing this, I've never heard of this simple formula that I've seen out there and about where people say, hey, you should do 1 milligram per pound body weight to maintain the gains, and then maybe just a little more, like 10% more. So to use that example, I'm 210 pounds right now. I would use 210 milligrams of testosterone a week, right? And the fellow that I viewed on the video here, he throws another 10% in there. But as a foundation, I think 1 milligram per kilogram is a good baseline. But there's a lot of contingencies. How much down regulation, up regulation? Are you getting good rest? Are you training as hard? The intensity. Are you doing any supplements? How are you sleeping? And again, if I have a lot of guys that come in that have been on mega doses of anabolics, AASs, for 10, 15, 20 plus years. And I have, be honest with you, I've never been able to optimize a man with testosterone at under 200 mgs a week. If a guy's been running 4, 8, 600, 1,000 milligrams a week of testosterone and other things for years, that man's going to need a lot more testosterone to maintain their lean body mass. Okay, so I've had to take guys who were, bodybuilders, abusers for years, and I can't optimize them on 200 mgs a week. I take them to 300 mgs a week. Problem with that, Stephen, is that in Florida now, I can't legally, no pharmacy is going to authorize my prescription for 240, 280, 200, 300 mgs a week. You know why? Because they're afraid of losing their licenses. The doc, the feds come and look at our books, so we're not gonna fill anything more than 200 milligrams a week, right? I'll tell them, but I have a guy that needs 240, 280. Sorry, doc, we're only gonna fill 200 mgs a week. So my hands are tied in that regard here in Florida. But I don't know if that answers your question, but the 1 mg per pound body weight for maintenance to keep the mass on board. When I saw that video, and that's the first time I have to tell you I heard that. It made sense. I went back and I called some people I know, some bodybuilders, some guys who've been doing this for years like myself, and they kind of concurred. But they said, how about one for one? And that was 1 milligram per pound body weight. But like the fellow in the video, I don't remember his name. You sent me that video, but I think he's 230 pounds. Well, I'm doing 230 mgs a week. He was doing 250. That's right. He was doing 250 because he was doing the 1 for 1, so 230 was 230, and they said I'm throwing an extra 20 mgs on top of that. Mm-hmm. But he felt that for his body weight, his activity, guy must have been I don't think he was 40 years old, maybe mid 30s. He's doing 250 mgs a week for his 230 pounds of body weight, because in his experience as a bodybuilder and in the pro world, he felt that's a good number for him. But since I can't do that, I just tell people that 200 mgs a week is all I can do medical legally to maintain what you gained. And but then again, if I have a guy that is doing very well on 150 mgs a week, is wants to maintain that, well, I can maintain him on 150. If he's 150 pounds, well, that's 150 mgs, right? 150 for 1 mil. Okay, it's pretty simple math. But in my travels, Stephen, I've never seen that formula. I researched it. I made some phone calls. It makes some good sense. But my first thought about that question was, man, there's so many contingencies about diet and exercise and your training and your supplementation, whether you do creatine monophosphate or don't, because creatine monophosphate is going to increase some cell voluminization and increase satellite cells, how much time you need off between sessions. We all know that as you get older, you need more time off from the gym than in the gym to actually make some gains. So that's the best I have for you on my nandrolone experiences, which are mostly anecdotal. And from my experiences, again, I don't do research on nandrolone.
Great. Thank you so much, Jeffrey. I really appreciate it. Now do this next. Click on one of these thumbnails to learn a ton more about TRT and hormone optimization.